Frozen embryo transfer is a treatment that is done on patients who have already got embryos frozen. Now, these embryos can be frozen from a prior IVF cycle, or they can be donated embryos to patients who are using donated embryos to get pregnant. But the process is the same. Embryos that are frozen are placed into the uterine cavity of the intended parent once the uterus is prepared. The way we do that is patients call with their period. We place them on oral estrogen for about 3 weeks. We monitor them on day 9, day 5, and day 5 again, so within the 3 weeks 2-3 times. And we basically titrate their dosage to mimic a natural cycle. And we then add progesterone to their regimen vaginally. And 3 to 5 days into that progesterone cycle, we basically thaw embryos and put them in the uterus. The purpose of that cycle is basically to get them pregnant with the embryos that are currently frozen. The cost is much less. Pregnancy rates are 3 to 5% lower. But the benefit of it is that patients who have either banked their embryos in the past and now want to get pregnant, patients who have done IVF and already have a child and now want a second child, and patients who want to adopt embryos of other patients who did not want those embryos anymore and they gave them up for adoption. Those patients can use frozen embryo transfer as a cost-effective and successful treatment plan.